Hello, welcome everybody. My name is Alejandra Marquez, and I'm glad to be here with all of you today to discuss how type 1 diabetes screening works and what to expect. At Diabetes Sister, our mission is to support and empower individuals living with all types of diabetes through education, resources, and community. And today's conversation is especially important because early detection of type 1 diabetes can have a profound impact on outcomes for individuals and their families. We are honored to be joined by our expert speaker, Dr. Victoria Bohair. Dr. B is board certified in endocrinology, diabetes, and metabolism, and as well as in lifestyle medicine. She is the founder and CEO of Perry Wellness and at Diabetes Center in Charlotte, North Carolina, and a proud board member of Diabetes Sister. She is deeply committed to improving healthcare outcomes and advocating for population healthy initiatives. Thank you, Dr. Victoria, for being here. I love Dr. Victoria. In addition to Dr. B, we are grateful to share two personal experiences with type 1 diabetes screening. Melissa Sled, you can see, and me, I'm going to share my experience. Thank you, Melissa, for being willing to share your story with us. Our agenda, as I told you, we will go first with a presentation. Dr. Victoria is going to explain you a little more about this topic. And then after the presentation, we are going to go to the breakout rooms and we are going to have Q&A where you can ask questions and listening what the other person has, and you can also use the chat to send us a question or share something. Please, I'm going to turn this to Dr. Victoria to do the presentation, and welcome everybody today on Saturday. I hope you have learning something about this and take action. Dr. Victoria, your screen is for you.
Okay, well, thank you so much for the warm introduction, Alejandro. And thank you all for coming today on this Saturday morning or Saturday afternoon, depending on where you're tuning in. So let's go ahead and get started on this very, very important topic, one that I'm extremely passionate about. So when we talk about diabetes, of course, we know that there are two different types, there are a few different types. The one we're going to talk about today is type 1 diabetes. And this is when the pancreas, which produces insulin through the beta cells, there is destruction of those insulin producing cells called the beta cells. And when this happens, then you can have increased levels of blood sugar. And those levels of blood sugars can really increase to a point where there can be complications, such as diabetic ketoacidosis, as well as other things, nausea, vomiting, etc. We all know that when it comes to having type 1 diabetes, there can be constant daily struggles. And this includes the need for constant monitoring, the need to make sure that we're giving enough insulin for the type of meals that we're eating. There's also the emotional struggles of having type 1 diabetes, from depression to diabetes to stress, anxiety, etc. Having to use insulin every single day, there's a cost factor when it comes to that, and also the dependence of insulin every single day. Thinking about exercise, you always have to think about what to do. Do you eat more carbs? Do you eat more protein? How much insulin to give yourself before exercising? So there's a lot of daily struggles when it comes to having type 1 diabetes. We also know that type 1 diabetes can be, you can have a higher risk of developing type 1 diabetes if you have either both parents with diabetes or either parents with diabetes. And this risk can go up to as high as 30%. We also know that majority of people, and that is over 85% of people who are diagnosed with type 1 diabetes, actually do not have a family history of type 1 diabetes. And unfortunately, about 40% of people are diagnosed in that life-threatening condition, diabetic ketoacidosis or DKA, at the time of diagnosis. So we have, type 1, where majority of people do not have a family history at the time of diagnosis. And then when they are diagnosed, 40% are diagnosed at the time with also DKA. When it comes to type 1 diabetes classification, we now actually have stages. And the stages is based on what we call antibodies. When we talked about what is type 1 diabetes, we talked about the beta cells and destruction of beta cells. The beta cells are actually destroyed by what we call autoantibodies. And these autoantibodies are proteins that go to the beta cells and essentially destroy them. Therefore, the beta cells are not able to produce enough insulin. What we know is that these antibodies can actually develop months to years before we actually show signs of type 1 diabetes. The stages of type 1 diabetes are stage 1, stage 2, and stage 3, where all the stages, the underlying commonality is that they all have at least 2 autoantibodies present. So if you screen for type 1 diabetes and you have 2 antibodies that are present, you are diagnosed with type 1 diabetes. In stage 1, there are no clinical signs of type 1 diabetes and your blood sugars are normal. In stage 2, again, no clinical signs, but you have mildly abnormal blood sugars. And in stage 3, that's where you have the clinical signs, what we typically see for someone who is diagnosed with diabetes. So that's your urination, increased thirst, weakness, in addition to high blood sugar levels. So that's those clinical signs. So again, stage 1, stage 2, stage 3. So why are we even having this conversation in general, and why is it important to screen early? And one thing that we really want to do is to reduce diabetic ketoacidosis. As I mentioned, 40% of people, when they're diagnosed with type 1 diabetes, are diagnosed having DKA. So if we screen, we're able to detect those who are either stage 1 or stage 2, we can actually monitor them closely. Studies have shown that those who are screened and monitored for type 1 diabetes, the risk of developing DKA decreases from that 40% all the way down to less than 5%. We also want to prevent hospitalizations and being prepared for clinical stage for clinical type 1 diabetes, which is stage 3. And that preparation is really having the understanding of what type 1 diabetes is. If you remember, I said over 85% of people who are diagnosed with type 1 do not have a family history. So something that's very unexpected. But if you're able to screen and if you have either stage 1 or stage 2, we can monitor you and give you the education that is needed, be it continuous glucose monitoring, pumps, etc. But you'll be prepared for stage 3. You also have access to clinical studies. There are a lot of studies nowadays that are following and also have innovative treatments for type 1 diabetes, and that's from delaying the onset of clinical stage 3. And there's a medication that we'll talk about soon to seeing if the beta cells can be preserved through different modalities. And then there's early treatments, and we'll talk about tezepelumab later on in the presentation, but there's treatment that can actually delay the onset of stage 3 type 1 diabetes. So when you get screened, you really have a lot of advantages from really that risk reduction of DKA, being prepared psychologically, being prepared in terms of financially, a treatment team in place, etc. when it comes to stage 3 type 1 diabetes. When it comes to screening in itself, we were really looking for the presence of antibodies that I spoke about earlier. There are 4 main antibodies that we look at. That's the GAD, the zinc transporter 8, the islet antigen 2, as well as the insulin autoantibodies. And these 4 are the main antibodies that we screen for. Sometimes you hear islet cell antibodies or ICA. Currently, the American Diabetes Association does recommend that we screen with these 4 antibodies. And these are very simple blood tests. When it comes to the different screening methods, and there are many ways in which you can be screened. At the very top here, we talk about the National Research Screening Program. So ASK and TrialNet are the major research-based screening programs. The ASK screening program is nationwide for adults and children. You do not need a order from your provider. It screens for both type 1 as well as celiac. And we'll go into more details, but for ASK, they do all the 4 antibodies for type 1 diabetes. TrialNet, also nationwide, they screen the ages of 2 to 45 if you have a first degree relative with type 1, and then 2 to 20 if you have a second degree relative with type 1 diabetes. No provider order is needed, and the focus here, they do celiac, but the focus is on type 1 diabetes. There are state-based screening programs, the Cascade as well as the Pledge programs. Cascade is in Washington State, Pledge is in South Dakota. And then Enable Biosciences. This one here, your healthcare provider actually has to order the screening kit that goes to their office, and then they can give that kit to you. Once you have the kit, then it can be mailed into back into the Enable Biosciences for the results. And then finally, any clinical lab can also do the screening. LabCorp, Mayo, and Quest. For those, that does require your healthcare provider to give you an order for the test, and you go to the lab and get the test done. The top Ask and TrialNet, they have home-based screening programs too. So if you prefer to be screened at home, you can go to their website and order for a screening kit to be mailed to your home. So I want to think about the benefits of at-home screening between Ask and TrialNet. So the 2 research-based screening modalities, they're actually free. The remaining ones that I spoke about will go through your insurance. So those will require the physician order, and that would go through the insurance. If it's mailed to you at home, it's convenient. It's also non-invasive. It's a very simple finger stick, and blood is collected either on a card or in a very small test tube. And then, of course, you can get the results, which are emailed to you, and you can also ask for those results to be sent to your provider. When it comes to the home testing, this here, I just wanted to give some examples of what you can do in order to have a very successful collection. And you really there's no need to fast. You can maintain on a regular healthy diet. You want to make sure that your hands are nice and warm. You want to be relaxed. So sit down, dangle your hands, make sure that there's blood flow down to the fingers. And then you prick the fingers and really massage out some blood into the container. And again, depending on which one you're using, it can be either a tube or a card. The Enable Bioscience Kit, as I mentioned, is a little bit different. This is ordered by your healthcare provider. The sample can be collected either in the office at that time, or you can take it home. After that, it's sent back to the address in which they inform you. They analyze the results, and then you receive the final results in the mail. So when it comes to the possible results, it can be absolutely no antibody is detected, which is a negative result. This means, and majority of people fall into this category. It really means that there's low risk of developing type 1 diabetes, really about the same risk as any other family member who has the same genetic risk factors. And then rescreening for that really depends on the entire clinical picture. Some people have a very, very low risk of type 1, and rescreening may not be necessary. Other people with a higher, maybe family history might want to rescreen. With the one antibody detection, this one here is an elevated but modest risk of type 1 diabetes. And again, the risk varies on the age, titers, the antibody type. The zinc transporter tends to be one of those that have the highest risk than compared to, for example, the GAD, where we see more in adults. And then if you have two or more antibodies detected, then that two or more give you the diagnosis of type 1, and you're either being stage 2, stage 1 or 2 if you do not have any clinical signs, and then stage 2 if you have higher than normal blood sugar levels. Regardless of which stage or if there's just one positive antibodies, as long as you have any antibody present, we do want to make sure that there's regular checks. If there's any antibody present, period, we do recommend that there is a repeat testing just to confirm. And then after that, if those antibodies remain, then depending on the entire clinical picture, we really individualize those next steps, be it for a younger child, if there's a high risk of family history, etc. Sometimes you might want it every 3 months, or if there's a lower risk, it might be 1 to 3 years of rechecking. And again, as I mentioned, throughout the process, you want to make sure that you're getting the knowledge and the support as well as resources needed if you're in those early stages. What we do know that's from stage 1 to stage, if you're at stage 1, within 5 years, you have a 45% risk of developing stage 3 type 1 diabetes. And if you're in stage 2, you have a 75% risk of developing stage 3. So we really want to make sure that you use that time to gain the knowledge and the support and the resources, etc., that you would need in order to prevent diabetic ketoacidosis, and also just to make sure that you're really equipping yourself with the possibilities when it comes to research, when it comes to medications, etc. So one of the exciting things that came in November of 2022, we had the FDA approval of tezepelumab, which is also called Tzield. This was actually the first medication to be approved to delay the onset of stage 3 type 1 diabetes. And if you can imagine, this is actually very, very huge, where we, for the very first time, have a medication that can delay the onset of the clinical signs that we see with type 1 diabetes. This is a 14-day infusion that you do once, and then afterwards we continue to monitor. We'll talk about that more with upcoming series. As you know, for more information, diabetessisters.org is equipped with a lot of different resources. We have webinars to different materials, articles, things that you can download on your own, things that you can give to your primary care providers. We do have a series, how, what, and why when it comes to screening for type 1 diabetes. So a lot of resources. So please head to diabetessisters.org for any additional information.